Mrs. Ewekoro is a 38-year-old woman. She's married for 10 years, and she came to me during a counseling session saying that her marriage is at the brink of collapse. Now, she told me that she's had about 8 miscarriages that didn't last for more than 3 months, and the husband, who apparently was much older than she is, has been complaining as to their inability to conceive and have a child. Now, his own responsibility as a man is being fulfilled because he gets his wife pregnant. But unfortunately, according to Ms. Sewekoro, medical reports reveal that she has fibroids existing in her womb that prevents her from carrying her pregnancy to term. Today on Nursing with Abby, we're going to be talking about fibroid, the baby rival. Hello beautiful people, you're welcome to another episode of Nursing with Abby. How are you all doing? Trust this meets you well. Now today, because of the lot of comments coming to talk about this fibroid issue, and I remember that I'm a nurse, I'm a midwife, I'm a public health advocate, and I love what I do. My name is Nurse Abiodun, and on this channel and on my YouTube page, I talk about nursing, I talk about lifestyle, and I talk about everything in between. Now on this particular episode, I'm going to be talking about the topic fibroid, the baby rival. Yes. Now, a lot of African women are going through this dilemma every time, and because of the lack of accurate information about this, let me call it, is it a disease or yes, it's a disease. It's a lot of them go through the route of spirituality. They start taking all sorts to try and shrink the fibroid in their womb. A lot of them start taking all sorts that are damaging to their system. Some even go to the extent of taking poisonous chemicals just because they're desperate and they want to find a way out of their dilemma. But today on Nursing with Abby, I'm going to be explaining to us what actually fibroid is in a layman terms. Remember, Nursing with Abby, we keep it short and we keep it simple, and we find solutions to troubling problems for women, children, and even adults in general. Now, today on Nursing with Abby, what exactly is fibroid? Now, I need you to just picture this as fibroid being a growth in your tummy. Now, it's an abnormal growth because normally your tummy should be, your womb, should be empty. So the growth in your womb that can, in a way, affect ability of a child to, grow inside of you, inside your womb. Now, such growth we have a lot of people who have growth in their womb and they do not have any symptoms. Most of them even take their children to term and there is no problem. But they might have what we call irregular bleeding. They might have more bleeding than usual during their periods, their monthly cycles. Yes, some might even have extended periods of monthly cycle. Maybe you can have like 10 days, 12 days of bleeding during menstruation. Now, some others could have what we call pain during sexual intercourse. We call that dyspareunia. While we have some others who could have cramping pains, especially during their ovulations and all that, which could be suggestive of fibroid. But seriously, all these symptoms are not indicative of fibroid, except a test is being done, which is an ultrasound or ultrauterine sound, or we call it ultrasound or USS in the medical world. A scan is being done on the womb to check the womb and see if there's any abnormal growth in there. And a lot of people ask questions as to this growth, could it be cancerous? Because people believe that anything that is like a growth, abnormal growth, is a cancer. We just have a few percentage, maybe about 2% in the whole of maybe like 1,000 women that would develop their fibroid into cancerous growths. So it's really nothing to worry about if the doctors has checked and they are certain that it is a fibroid, and most fibroids are benign. That means they are not cancerous. So taking that out of the way, how do we now deal with this? Now, a lot of people, like I said, might have issues of this fibroid inhibiting their ability to carry their baby to term. Fibroid really do not really cause sterility, let me put it that way, but it could lead to infertility issues, because when you have a woman who is menstruating all through the month, when exactly does she ovulate? When exactly does she conceive? So that could be the angle. But for those who actually conceive, there could be the increase in the size of the growth. And that is because the pregnancy hormones that help with the nurturing and maturation of the baby also has its own effect on growing the fibroid already. Yes, and that's why a lot of people have issues with the fact that when they are pregnant and their hormones are trying to develop their baby, it's also developing the fibroid inside of them. And by the time the fibroid becomes much bigger than the baby, it definitely will squash life out of the baby, and that's why some women do not carry their baby to term because of the growing growth in their womb. And now a lot of people they've also complained of symptoms of postpartum hemorrhage. Yes, that's what we call when a woman bleeds after delivery. And that's common with fibroid prone wombs. Yes, for wombs that have fibroid and they're probably the fibroid did not disturb the baby from growing. On the day of delivery, we could have excess bleeding excess bleeding after delivery. Now, what exactly do we do to this fibroid? How do we manage it? Now, a lot of gynecologists do suggest that if the fibroid does not have any detrimental effects to fertility, does not have any detrimental effect to conception and growing the baby to maturity, then the fibroid be left alone. That's what quite a number of gynecologists suggest. But for those who have some effects, we could have drugs that could shrink the fibroids. That's definitely going to be ordered by a gynecologist, an experienced obstetrician and gynecologist in the field. Also, we could have painkillers that help with dealing with the pain, especially during the cramping during the menstrual cycles or during and after sexual intercourse. Now, we could also have some laser surgeries that have been invented now that could help with trying to shrink or trying to, how do I put it, cauterize. That's the word. Cauterize means that it reduces blood supply to that fibroid, and then definitely whatever blood doesn't go to definitely will die. So that's another method, but that is definitely under strict obstetric and gynecologic assistance with the use of the equipment and the machines and all that. But we do have those that are on the extreme, which we might need to go for what we call a surgery where you have to remove the fibroid. We call it myomectomy. Or the most severe cases when you have extreme bleeding that could terminate the life of the mother, they could take out the womb, which is called hysterectomy. Now that occurs definitely in cases that is life-threatening, that we are going to have the chance of either saving the baby, saving the mother, or losing her completely. Then they might need to take out the womb. Or maybe a woman who has delivered more than enough babies, maybe 12 the children and all that, and she's still having the symptoms that could hinder or hamper her health, then they might say she might not need the womb anymore. They take it out and she's free. But quite a number of women also, they might have the natural way of fibroid shrinking, and that's menopause. Like I said, the hormones are involved in growing the fibroids. By the time the hormones start work, that's after menstruation, of course, during menopause, definitely the fibroid automatically shrinks, and it doesn't have any detrimental effects to women of the older age or the older age bracket, which are in the menopause cycle of life. Now, a lot of people believe that there are some drugs, there are some herbs that can be used to shrink fibroids. Right now, medically, it's still not proven that there are actually some drugs that can help to shrink fibroids, because some people will tell you immediately you take this particular concussion, you just excrete it, and you see the whole lump of fibroid inside of your maybe your underneath and all that. Well, right now medically there's really no clear-cut drug that is used to do that. So a lot of things that are being taken in could actually be very, very injurious even to the woman, yes, to her health, before we even talk of having to conceive or having a baby till term. But I would like to tell all women who are going through any form of symptoms of fibroid that you should please hang on. Make sure you seek help from the medical professionals. Not all doctors are gynecologists and obstetricians. So please ensure that you get the experienced ones that will help you way through the journey. They will place options right on your table, and you would, with decisive thinking and decision making, will be able to make informed consent as to your choice of treatment to manage this fibroid. Now, for a woman whose life is threatened, they might say hysterectomy might be the only solution, while for some women it might just be removing the fibroid and keeping the uterus safe and all that for another childbearing episode. So it depends on what it is being laid down, the condition of the woman, and then what exactly is to be done. So I hope with this, if you have any comments, any questions about fibroid, please put in the comment section. I'd love to hear from you. I'd love for you to share this video to those who are probably having one issue with fibroid or the other. And also subscribe, and also ensure that you like this video. Thank you so much for joining me on this episode of Nursing with Abby, talking about fibroid, the baby rival. If you're still a nurse, you want to migrate to the UAE, you have questions, you have comments, you want to know more, please reach out to me. I'll be glad to help you with my own wealth of experience. I know the little I know about it. I'm a nurse licensed to practice both in Nigeria and in the UAE, so I could help you with an information or two. Till I see you in my next episode. Bye for now.